Hi, my name is Irene and I will be doing my speech on asthma. As a newly diagnosed asthmatic, there was a lot of things that I had to learn. Over 17 million people in the United States have asthma, with one-third of them being children. Asthmatics have gone to the hospital over 2 million times in the past year due to asthma attacks or asthma-related problems. By the end of the speech, you guys will learn everything about asthma and an in-depth look of what the lungs really look like and how they function with asthma. There is no legitimate cause or known cause as to why people get asthma. People with a family history of asthmatics or of severe allergies have a greater chance of being diagnosed with the disease. Also, people at risk to get asthma are premature babies and also children who have been exposed to smoking or their mothers were smokers during their pregnancy. Some symptoms include shortness of breath, especially at night or with exercise, wheezing, which is a whistling sound when you're breathing out, coughing that is usually chronic and dry, and it often occurs in cold or dry weather, during or after exercise, and at night or early in the morning. Chest tightness is also another symptom. It may occur with all the symptoms that I have just stated, or it can be the only symptom that a person experiences. Other more in-depth characteristics that doctors might look for that will be tested on is how the obstruction of the airways are. They are also looking for the inflammation in your bronchial tubes, which is where the air travels through in your lungs. And they also look for how inflamed they are because they're usually red and swelled. They look for that because this inflammation, if it's chronic, it can lead to permanent damage in your lungs. They also have allergy testing to see what exactly you are allergic to, so that way you know what type of allergens trigger your asthma attacks. Some of those triggers include illnesses such as colds, flus, bronchitis, pneumonia, or sinusitis, which is an inflammation of your sinuses. Some allergens can include pollen, dust, pet dander, odors such as strong perfumes, cleaning products, air pollution, and tobacco smoke. Exercise can also be a trigger of asthma. This type of asthma is also called exercise-induced. The weather is another factor to triggers of the asthma because of the changes in the climate, the temperature, and the cold air. And also, emotional triggers cause the asthma to become hyperactive, such as stress and anxiety. An asthma attack is also known as an acute asthma attack. It happens suddenly with all the symptoms, the shortness of breath, the coughing, the wheezing, and the chest tightness. It usually occurs when a person is exposed to a high dose of an allergen that they are allergic to, or also when the person is sick. Signs of someone having an attack is all the symptoms of asthma, the chest tightness, the wheezing, the coughing. They're usually unable to speak or walk without being very short of breath. Their lips during an asthma attack have a bluish tint. The person may feel like their chest is closing. They usually hunch over, and that's how they catch their breath. It is the only comfortable position that they feel when having an attack. They also feel agitated. Sometimes they become confused and they're unable to concentrate. There's also a severe asthma attack, which is a status asthmaticus. And this is when none of the medications for your asthma work, and this requires an immediate medical attention, and the best place to go is the emergency room or to call 911. Treatment of the asthma would be having your regular doctor's visits, make sure you are exercising and eating well, The types of medications that you might be prescribed would be a bronchodilator, which is an inhaler, which is what I have here. I use this whenever I feel the chest tightness or whenever I feel an asthma attack coming. There's also breathing machines, which is another thing that I use during my asthma attacks. It's a nebulizer treatment. It's a machine and it's hooked up to a mask, and there's medicine that puts in there, which is a corticosteroid, which helps with opening the airways, and the mask is placed over your mouth and nose. Um, in emergency situations, when somebody is having a severe asthma attack, doctors inject the patients with epinephrine, which is adrenaline, because it helps with opening the airways even more when the bronchodilators and nebulizer treatments do not work. Doctors also recommend that you receive the annual flu shot because of asthmatics being more prone to getting the flu, getting bronchitis and pneumonia. And also, if you're a smoker, they also suggest that you stop smoking because smoking only makes the asthma worse. Um, as you can see, asthma is not a curable disease. I am the type of the adult onset one. Um, I was diagnosed because I have had bronchitis one too many times. I had all the signs and symptoms. I have asthma attacks usually once or twice a week, which makes me have the mild type of asthma. Um, it's hard to control sometimes. Um, you must always have your medication with you. I always carry my inhaler. You never know when an asthma attack will occur. Um, so as you can see, asthma is not a curable disease. Um, the asthma attacks can happen almost at any time. Um, we are more prone to upper respiratory infections because of our lung sensitivity. So now you know the true problems that asthmatics face on a daily basis, and also everything you need to know about asthma.